All right, so welcome everyone to another Fuller ANST lecture series for spring 2025. Um, I'm glad that you guys were able to make it. Um, Real quick before we give the platform to Dr. Spezzaferri or Mitchell, how would you like us to call you?
Mitchell is just fine. Yeah.
Okay. So welcome to the Fuller Neuropsychology Group. Real quick, if you're thinking about joining the Fuller leadership team for the next school year, um, please send us an email of interest to the Neuropsych Society at fuller.edu. Just send a email telling us that you're interested, and then we'll give you more information on what's next after we receive that email. Um, and and before we get started, I'm going to introduce Mitchell. He holds a PhD in clinical psychology with an emphasis in neuropsych from Fuller. He is a lecturer at University of California, Irvine, and was previously an adjunct professor at Point Loma Nazarene University and Fuller Graduate School of Psychology. Dr. Spezzaferri or Mitchell is currently completing a postdoc fellowship in neuropsych at the VA Long Beach healthcare system. His clinical experience includes a range of neuropsych work in various settings, including VA, medical centers, public safety net hospitals, and rehabilitation hospitals. His research focuses on social cognitive functioning, particularly in individuals with neurological conditions. Mitchell has extensive experience in teaching psychology at both undergraduate and graduate levels, and he has also contributed to numerous peer-reviewed publications and presentations in the field of neuropsych. It's a pleasure to have you, Mitchell, and take it away.
Awesome. Thank you so much for the kind introduction. It's also really encouraging and just kind of comforting to see some familiar faces here. So I appreciate you all joining, probably after a long day of either practicum or clinical work, other clinical work. One, if I have some questions, can I send them to you to post in the chat? Would that be okay?
Yeah, yeah, no problem.
Okay. They're kind of just to get a pulse for kind of where people are at. It'll help me guide kind of our time together right now. Um, so,
Let me make you co-host too, just in case you
okay.
need.
Let's see if that works.
Okay.
This is great. Okay, now I can like see everyone's chat, and that's going to be perfect. Okay. So I've got a couple questions here. It'll be helpful. You can just reply to the chat with a number, either 0 through 5, 0 being like not at all, 5 being quite a bit. Um, so the first one is kind of how would you rank your knowledge of the length it takes to become a neuropsychologist? And again, no wrong answers here. You're not going to be judged on these responses, just kind of curious to see our knowledge base.
So is this supposed to go to you or Juan? Those are the two
Um,
options.
oh, okay. They can just go directly to me then. That sounds good. Thank you all. Okay, hopeful. I am going to post another one. You can send your replies to this one as well. But this is how would you rate your knowledge of the requirements to become a neuropsychologist? Same kind of scale there, 0 to 5. Okay, excellent. I see some coming in. I appreciate that. I've got just two more for us. Alrighty, so this next one is how would you rate your knowledge of the salary of a neuropsychologist? Same scale here, 0 to 5. 0, I have no idea. 5, I can hit it on the money. Okay, some more responses. Thank you. Thank you. And then last one here. See a few more coming in. Appreciate it. Okay. And this last one is, how would you rate your knowledge of how to connect with others in the neuropsychology community? And so here, specifically thinking outside of Fuller. Excellent. Okay. I appreciate your engagement with that. That kind of helps me get a good sense of how to tailor like the speed of the presentation to not bore us with things that we already know. So that sounds good. Let me dive in then. So what I'm going to do is I'll talk kind of just about the journey to become a neuropsychologist broadly. I'll talk about my journey through Fuller and some of the things that I did as part of my training to set myself up. And then I'll spend some time talking about what I currently do at the VA as it relates to my role as a postdoc. And then kind of finish up with like a Q&A and kind of anything to share. Let me just I've got a little presentation going because I'm a visual person. This will help me stay on track too. I'm assuming you all can see that okay now.
Yes.
Yep, yep.
Wonderful, wonderful. Okay, so most of us rated that we have pretty good knowledge of kind of the length of time it takes to become a neuropsychologist. So here are kind of a few things I'm going to talk about and kind of breeze through. But one of them is about the journey. So it'll kind of be our first benchmark as we kind of dive into things. But if you had to guess, so we kind of rated ourselves somewhere between like 3s, 4s, and 5s for the most part on this. So I'm kind of curious to pop back in the chat now. So from starting of your bachelor's to finishing your postdoc, how many years would you kind of estimate that is? You can throw that into the chat as well. What are we thinking? You can send that to me. From start of a bachelor's degree all the way to, yeah, from the start of a bachelor's degree all the way to the end of postdoc, how many years are we talking to kind of consider the training with neuropsychology? Yeah, I'm seeing some good answers here. Anywhere from 14 years, 12 years, 13, 9 or 10, 8, 11 to 13. We're in the ballpark, so this is looking good. All right, yeah. So typically, you might complete your bachelor's in 4 to 5 years. That graduate work may take another 5 to 7. And then for neuropsychology specifically, you're looking at another 2 years to specialize in neuropsychology. And so when you kind of add all that up, you're looking at a pretty significant education history, kind of 10 to 14 years of training, both coursework, clinical training, research, whatever that may be. And so it's a significant chunk of time and period of your life. And so it's more of a marathon than it is a sprint. And as someone who's kind of ending or able to see the 26.2 mark at this point, it's getting close. And so I'll kind of breeze through this. You're familiar with some of these, but what I wanted to highlight here is just different areas that you can train at. Some of the things that go into part of this, a lot of this is part of your neuropsychology focus at Fuller is being on the track. And then just a lot of different clinical training opportunities. I'll highlight some of the ones that I engaged in, but I'm sure many of us have different training experiences. And so are likely at a host of these or might have interest in training someplace else in the future. But just know there's a lot of opportunity out there in terms of training. And so this is kind of what that clinical component looks like. You've got your practicum, you've got the internship or residency. I know a few of you are off to that next year, which is exciting. And then to really focus and kind of do some work in neuropsych, the postdoc becomes pretty important. And there are a couple of different focuses that may kind of lend themselves to neuropsychology. And so as you might be considering this, even this fall for a few of you, even though you'll just be starting off internship, know that you might look at postdoc programs that maybe have a special area of focus or specialization in neuropsychology specifically. They might even have a focus in rehabilitation psychology. They may combine the two. You may see kind of the wording of neuro rehab is part of that. And then oftentimes neuropsychologists work with older adults. And so you may see like a gero-focused fellowship as well. And so all of those could be opportunities to kind of get training in neuropsychology. Just note that if you're looking to kind of follow Houston Conference guidelines, that formal 2-year neuropsych postdoc is going to be the only one that kind of fits that, though the other ones have their own kind of specializations as well. But just want to kind of highlight what that looks like. All right, this is kind of the fun one. So for us, we had kind of a sense, we ranged from 0 to 5 in terms of what we think a neuropsychologist might make. And this is kind of helpful. We're in the education system for a very long time, and so we often might accumulate loans and want to consider like how might we pay some of these off. And so these are based on the American Academy of Clinical Neuropsychology. They do an annual report, kind of looking at salary, and they break it up a couple of different ways. And so what you're kind of seeing as you look at this is kind of broken up into career stages. So early career, kind of that first 8 to 10 year mark. After postdoc, mid-career, that next kind of 10-year mark, and then that advanced career later on. And then it's breaking it up between large medical centers, private practices, people who might do a combination of both medical center and private practice, and then overall kind of what those pay ranges look like. And these are kind of the medians that are here in terms of pediatric neuropsychology, if that's your area of specialty, or adult and lifespan. So you can kind of see some general trends as you look at these. Overall, income increases over the course of your career. Private practice tends to be a little bit more lucrative than medical centers do. And then there seems to be kind of a pretty even keel in terms of pediatric and adult neuropsychologists throughout the career. So something to kind of consider, worth kind of knowing if that's something you want to keep tabs on. The AACN regularly kind of posts this every year, every other year. So it's kind of helpful to see the different trends. There's a lot more data. They look at kind of forensic work and things like that, but I thought I'd just share some of these as they relate to some of my own experiences, as I'll get into. Let me pause here. Questions up to this point, just kind of the roadmap, the journey part of it that we've covered so far.
I am sort of curious about with the changing landscape in terms of jobs. I'm wondering what those numbers would look like next year. Um, and since you're in the field working, what are you noticing in terms of job security?
Mhm. It's an interesting question. I'm an employee of the federal government, and so the past couple of months have been very interesting. I'll dive into that more as I talk about what I do.
Sure,
Um,
sure.
but for federal employees, they're currently going through a reduction in force, and so that's a question kind of on every um, person's mind. And so I'm not sure how much that extends to other medical centers or whether that looks the same for folks that are working in private practice or have contracts with schools or other institutions where they get their referrals from. But yeah, I think I'd be curious to see in the next even couple of months what we tend to see, at least from the government side, in terms of the stability of the workforce.
Hmm, hmm.
Yeah.
And I find it ironic too because before I applied to grad school, I kept hearing, "Oh, make sure you go to the VA because that's the most stable and they offer the most pay for those who intern." And now it
Yeah.
seems to be a grand reversal. So maybe not grand reversal, but there's a definite change.
I typically thought of it as a very large ship that takes a long time to turn, and I have been shown that it is a faster moving ship than I anticipated. So, yeah, something to kind of just be mindful of. I think one of the benefits, and I'll touch on this in a moment, is that I think clinical psychology broadly, and the neuropsych even more specifically, has a lot of flexibility in what they can do. And so just kind of the clinical practice side may just be one arm of how someone chooses to kind of provide for themselves. And so in kind of a shifting landscape, it may be that you lean into some of the other aspects of your training or work experience, and that's a way that you kind of support yourself. So as I go through some of the ways that I've navigated that, it may provide some inspiration or may bring up some more questions. So feel free to ask away. Okay. Wonderful. All right. So here's a little bit of my journey. I'll talk about kind of how I navigated the higher education system, what some of my training looked like, and kind of why it makes sense where I'm at right now. And then even some of my life at Fuller. I know this is a specific kind of neuropsych talk, but I think there's a lot that can happen in grad school that kind of sets yourself up for life afterwards. And so I'll kind of share a little bit about that for myself as well. So my academic journey is kind of, Juan had noted, so my PhD is in clinical psych. I have a major area of study in neuropsychology. That's kind of how we say it outside of the school world. But it's the neuropsych track is what I completed. I am an alum of Warren Brown's lab. I was on the hemispherectomy side. And so I got to do a lot of research on kind of some neuropsych related things in terms of epilepsy, in terms of kind of lateralization of brain functioning and things like that. And so a lot of my research work was also neuropsych related as much as it could be. And really bringing in as much as I could, some clinical interpretation and kind of work into that. Some other ways that were kind of academic that I kind of began to tap more and more into the neuropsych world was through both paper and poster presentations at conferences. And so this is something that I definitely encourage students to do. I know that Dr. Nolte does this as well. And it's a great way to really see what the world of neuropsych is like, to experience a conference, to kind of connect with people and do that kind of warm networking there. And so I'll pitch this for all of us. Maybe I'll see some of you there in person. But the National Academy of Neuropsychology, NAN, is actually hosting their conference here in Los Angeles in November of this year. And so that may be an opportunity that you consider. I was just checking out their website before I logged on, and they actually are providing conference registration and conference housing for students that volunteer. So if that's something that interests you and that may be a barrier to attending your conference, that may be something where you can meet other student volunteers who are also obviously interested in neuropsychology and get some of those things paid for. I love this picture because you get to see Warren smiling. I feel like sometimes that can be rare, but it's so sweet. My clinical journey, I did a mix of things among neuropsychology. And so that's a little why I highlighted that fellowship-wise, you can go a lot of different ways, is because some of these showed me that there are lots of opportunities out there. But through kind of my clinical training, I started out in really community-based settings, and that set my trajectory for the most part. And so you may kind of pick up on a theme here in that I tend to work in public-facing settings for people who are uninsured or underinsured. Kind of the exception, and also my typo on this page being HMRI, kind of working at a high-end research institution here in Pasadena. And that was really my first gig in neuropsych, and kind of really diving in head first, getting an idea of imaging and how that relates to our testing, and so looking at experiences like that. Later on, I got a lot of rehab-based experience at Rancho Los Amigos. I had opportunities to work with patients with spinal cord injuries, really young kids, infants and babies with pediatric brain injuries, as well as epilepsy. And so this was a neat opportunity for me to get some just different types of experiences. I had a lot of assessment experience, but kind of this patient bedside evaluation rehab part was a muscle that I began to develop here, and it kind of stuck with me. And then I kind of was at All of You UCLA for my clerkship. And so this was a really heavy testing-based, outpatient-based neuropsych site with some inpatient work. And so here I got to really see that I enjoyed that inpatient side. That spark that began to kind of kindle with the rehab work at Rancho, I got to see as I was doing some inpatient-based assessment on medical floors and in the psychiatric unit at All of You, to kind of get an idea of how people were functioning in terms of their cognition, both with complex medical conditions and intense psychiatric conditions. There was also a flavor of forensic work here that I got to kind of experience as well. I got my really Gero focus at the West LA VA. This is my first introduction to federal work. I spent a lot of time in an acute rehab unit for folks that were coming down from different types of surgeries or injuries. And so that rehab kind of role continuing to be fostered here. And then also spent some time outpatient wise working with older adults who we're having dementia, we're doing a medication eval to consider treatment opportunities and things like that. So giving quick screeners like the MOCA, stuff like that to evaluate cognition. I matched at Denver Health for internship phase 2, and I'm really grateful for this decision. I actually was grateful to get out of the area since I had done a lot of my training in Southern California. This is the largest public safety net hospital outside of LA General. And so here you see just a combination of different things. It's a level 1 trauma center. And so I got to work in the emergency department as an intern and see the fast pace under a psychiatrist doing evaluations and evaluating cognition. I did epilepsy surgery evaluations and then did kind of your general ADHD clinic stuff as well for actually both employees in the hospital and folks in the community. And so this got to really see how a very large medical system works. I was part of a cohort of 20 different interns. And so this was kind of a really unique learning environment for me. I was the only neuropsych intern, which is a pretty common experience. So just kind of prepare yourself for that. Those of you going off to internship, there's often just one of you. So you make a lot of friends with folks even outside of neuropsychology. And then currently I'm at the Long Beach VA. And so I'll talk a little bit more about this in just a moment. But I'm sure many of you have been to some of these sites as well. These are very common for folks along the neuropsychology track. You may know some of the supervisors I've had. And so I think that's just really great. These sites offer a lot of great opportunities. Alrighty. So what did life outside of Fuller look like for me? I had kind of a complicated life in grad school, I would say. I chose to get married. We got a dog who was very energetic. We had a child. I got to teach quite a bit outside of school and then spent a lot of time outdoors. And so a lot of this was a mix of continuing to kind of move life forward, even in the midst of graduate school for us. And also mix in some kind of advancements in terms of some of my professional growth. I knew teaching was going to be a part of what I did long term. And so I wanted to kind of keep that going really briefly and kind of in a minor way, but try to do that as much as I could. And then a big self-care thing for me is going to be spending time outside. And so that's one of the reasons why we loved Denver is because it is just the outdoor capital of, I would say, probably the United States. It's pretty neat. And so it was a great place to just spend a year as a family and stuff like that. And so my time at Fuller was kind of this constant push and pull of this professional identity developing as well, but then just myself developing and in terms of roles and identities constantly shifting year by year from husband to father and things like that. And so that was kind of a unique part of my own development alongside of my development as a young professional. Whenever I can get a picture of Zoe in here, my daughter, I always will. So here's kind of what I do at the present. So I'm a neuropsychology postdoc at the Long Beach VA. There's actually 2 of us here, which is really, really nice. And then there's a Fuller student or a Fuller almost alum coming next year, Bethany Ferguson, who'll be the first year postdoc. So we're really, really excited about that. I have a mix of rotations. My primary kind of area of study here is neuropsychology, but a lot of the training is neuro rehab focused. And so I spend about 50% of my time doing clinical work and then 50% of my time conducting research and then doing kind of supervision or other admin related tasks. I rotate through our outpatient neuropsychology clinic. I rotate on our spinal cord injury floor, as well as our blind rehab center. So I do kind of the typical neuropsych things. I do quite a bit of comprehensive assessment. I do feedback with patients and their families. I provide tiered supervision to our doctoral students and interns, and then conduct some research and kind of some operational improvement, QA, QI type projects. That's what you read about in the brochure that I do, but I'll tell you kind of what my day-to-day looks like here. I see veterans across the lifespan. So I see veterans who just are leaving the military. In fact, I saw a veteran who was medically discharged just a few weeks ago and then was in our clinic. I then also see veterans who are not World War II any longer, but Vietnam. So in their kind of late 70s, 80s, sometimes early 90s. And we may see them for a host of reasons. I may see our younger veterans related to a blast injury. I may see older adults who are concerned about their memory, things like dementia. We do deep brain stimulation pre-surgical evals here for Parkinson's disease. And so our neuropsych team is part of conducting the pre and post-surgical evaluations. And then I also see a lot of veterans with psychiatric conditions that also have a secondary impact on cognition, like PTSD. I really like it here. I was formally trained, excuse me, with a lot of paper and pencil neuropsych tests, which is great because you get to kind of understand the basics of it all, right? You get really good at counting. But recently have dove into a lot of more teleneuropsychology and using technology. And so we do quite a bit of computer and iPad based assessment. And so it's kind of been fun to integrate that into some of my learning and the tools that we use. I also write a lot of reports and spend a lot of time in Microsoft Word. So if you're currently doing that as a clerk or as a pre-intern, note that's going to keep going along. It's what we do. We become really good writers. And so I spend a good amount of time doing that as well. I also provide some scaffolded supervision for doctoral students and interns, helping the clinic kind of move along, helping them in their training. And then additionally, I'm helping kind of our program continue to set itself up for success in terms of continuing to train others. And so that's part of kind of the research, the kind of QI quality improvement projects that I'm a part of as a postdoc. And lastly, what I get to do in part of my time is conduct research here through the institution. And so I'm currently involved with a project that is looking at how to help other healthcare professionals who aren't neuropsychologists or experts in cognition better understand how to use the MoCA, and in a way that allows our clinic to get more accurate referrals through the consult line, and really kind of get a better understanding of what a veteran's needs are to kind of free up our wait list time. So that's kind of a fun project I'm involved with right now. We're about to actually employ the training, but that's kind of something fun you get to do on both internship and postdoc is oftentimes research-based projects. And so always something to kind of consider and continue. Alrighty, a couple last things, how to kind of connect to the community of neuropsych. We had some mixed kind of, excuse me, ratings on this. And so I want to just offer some resources. A couple of great websites here. Many of you may be familiar with them, but the Navigating Neuropsychology podcast cannot go without recognition. The Testing Psychologist is also a great podcast, though not focused on neuropsychology, talks a lot about assessment, psychometrics, things like that. And then No Neuropsychology is a great didactic series online. They cover a host of different things from just really experts in the field of neuropsychology, in a way that gets you to see like there is a lot that a neuropsychologist can do and some really niche things and then some really general things too. So it's sometimes neat to be able to see that. A couple of organizations to consider. New to Neuropsychology is for students. It's really focused on undergrads and high school students, but they're always looking for mentors. And so as a doctoral student, this would be a great opportunity. You obviously are familiar with ANST as part of this group. But a couple others would be INS, and then I mentioned NAN earlier, the National Academy of Neuropsychology. And so just some other organizations to consider either investing in or becoming a member of. All have their own annual meetings, things like that. Lots of them on social media. And so there may be more affinity-based groups. Some of them are educational-based groups, but I've included all the handles here to just consider in terms of other groups and ways to connect with peers or maybe affinity interests, things like that. And then two more resources. Some of it was where I got information from today's content and then even beyond this. But Becoming a Neuropsychologist by John Balone and Ryan Van Patten are great resources. And then Katie Block just released the Neuropsychologist Roadmap. So kind of a unique way to further kind of understand career path, opportunities, things like that. All right. Thank you so much. Appreciate the engagement. I'll kind of leave some space for questions, comments, anything like that.
Thank you for the presentation, Mitchell. If anybody has any questions, go ahead and unmute yourself and jump in. I had a quick question. Can you speak a little bit more about the blind rehabilitation that I saw? Can you what you do there? Yeah.
Sure. So there are a lot of different medical conditions that may leave someone with visual impairment, whether that's something like multiple sclerosis or whether that's diabetes, or potentially a brain-related injury that leaves them without vision or with diminished vision. And so our VA will see them and kind of offer opportunities in medical care for them acutely often. And so some of those things also impact cognition. And so while they're there, we'll do kind of formal assessments while they're kind of housed inpatient. It's been neat. It's been really challenging because if you think about the tests that we give, they're heavily visual in nature. Even some of our domains are visual. But there's actually a great Fuller alum, Dr. Ashley Valancourt here, who leads the clinic, who is actually like utilizing and kind of helping develop materials to evaluate cognition for folks with visual impairment. So,
Thank you. Yeah, that's pretty interesting. What would she substitute? I guess we have the visual memory, for example. So would she solely focus on the verbal memory?
Yeah, so she'll, sorry. One of the other forms of memory could be like tactile or haptic memory. And so there are different tools that might have different patterns or textures to them to be more sensory. And that might be a way to kind of look at more right-sided kind of memory involvement. And then kind of haptic might involve kind of similar brain pathways, it's hypothesized. And so that's another way that we might look at kind of contrasting some of someone's verbal capacities for memory. Yeah, Cameron, do you have a question?
Thank you for the great presentation. I kind of had one question, but maybe two parts. I'm curious what you would recommend on setting yourself up. I'm almost in my fifth year, so getting towards internship application stage. So I'm looking at what makes someone a competitive kind of applicant. I mean, hours, training sites, things like that. I know anything else you'd recommend. And kind of part two of that is I know normally in the fall of your internship year is when you're looking and applying to postdocs. I wonder what that looks like. I mean, are hours still considered in the same way they would be for internship? Is it different? I'm just curious to hear more about that side of the process as well.
Fun. You're like just getting settled in, and then you start the chaos of all things postdoc. It's intriguing. Yeah, I can talk to both of those things for sure. So your first question was on like kind of internship applications, competitive apps, and then I think what I'm hearing too is specifically for like a neuropsychology like focused or like track internship position. Okay. I think something that's kind of helpful to consider, and this is a big learning for me as I navigated the internship application world and got a lot of input from like different mentors I had and got some feedback from them, was internship is still generalist model. And so they're still looking for a really well-rounded applicant who is able to conduct therapy, can do like an intake evaluation, also is doing assessment that might be related to neuropsych. And so as you're writing up materials and developing that, to consider how you're balancing both those things, right? You want to be able to highlight your expertise in kind of, or your developing expertise in these brain behavior relationships, while at the same time not neglecting that clinical like foundation that you have. And so, especially if it's been a while since you've had maybe a clinical based or a more like therapy based practicum, to find ways to kind of make sure you're reeling that in, to not just look like you're a little more lopsided towards neuropsychology. There, there are some sites that are really looking for someone who's neuropsychology heavy, but I found that those are just not as common, and those tend to be like really competitive and more research based than clinical. And so, just kind of remembering that balance as you're developing your materials. Because I think that's what's going to set you up as they're seeing, because it's not often a neuropsychologist that's reviewing your materials. It could be anyone from the internship program, right? And so they might not know what makes an applicant competitive, but they may be the first filter, the first round of eyes. And so you've got to catch them too. And so that's kind of something to consider as well. You're likely not meeting a neuropsychologist or getting that review until that second or third review, that interview kind of thing. And so kind of keep that in mind with your materials. There may be the case where the training director is in fact a neuropsychologist. In that case, it may look a little different, but for the most part, by and large, it's not going to be a neuropsychologist who's the training director. So, second part to that being like, what does it look like as you're transitioning? I'm thinking of Nate, I'm thinking of Juan as I answer this question right now. It basically starts right away. So typically you're starting internship in August, September, maybe a little earlier. And from what I recall, some of them were due in November, some of them are due early December kind of things. And some sites were offering interviews before Christmas, and we're going to make an offer before Christmas. Others were a little bit slower paced, and they're early January, February kind of thing. So again, reading through the brochure will kind of help with that. What's helpful to consider here, especially if you're not like haven't matched for internship yet, is that internship sites will like set their rotations different ways. And so sometimes you're doing a lot of neuropsych work at the beginning of your internship. And so you're accumulating those hours. That's maybe how they have it set up for a specific reason. Some aren't. I think that's less of a concern is the hours part. And it's more that you'll get some type of neuropsych related time, hopefully 50% of that time during your intern year. But yeah, you're kind of scoping things out. You're really looking at geography. Sometimes you're looking for those connections of people that you've met or have been at other sites to kind of figure out what postdoc looks like. Because it's a little bit bigger of a commitment than internship, especially for neuropsychology, because they're looking at 2 years with you. And so you're also looking at 2 years with them. So that's something to consider as you're going through your materials as well. There can be a lot to balance in the fall, as you're like just adjusting and kind of just getting your feet kind of on the ground. You're having to ask your supervisors for letters already, who you just met a few weeks ago, kind of thing. But they also understand that's the process, right? So this is not new to them in any way. Like they've been through all of this before and they're well aware and like, oh yeah, my students are going to ask me for letters. They're going to ask me to review materials, things like that. So that being said, don't feel like just because you're at internship, you can start to like slack off or kind of get, loose handed with things. Because again, those first impressions are going to be part of those letters. So really kind of hit the ground with a really firm grip on what you need to get done to kind of make sure that things are where they need to be. I'll just leave it at that. Yeah. Did that fully answer the two parts you had, Cameron?
I'm sorry.
Did that fully answer the two parts
Yeah.
you had? Okay.
Thank you.
I just have an add-on to that. What have you found, or what's your impression of what's more competitive? Is it the neuropsych internship or the internship that follows Houston guidelines for neuropsych, or is it the fully neuropsych 2-year postdoc?
Yeah.
Okay, Nancy, I was gonna ask the same question just in a second. Thank you.
Yeah. Great minds thinking alike here. I don't have like data to support this, so this is more qualitative or colloquial. If AFIC wants to release it, I'd be happy to analyze it. But I would argue that the internship itself is more competitive. I think there are fewer sites because there's often only one position per site, and then neuropsych is just becoming a more popular field of study. And so I'm not sure if proportionally the number of opportunities at the internship level is increasing with the number of trainees that are going through neuropsych related positions. I don't have a lot of data to support that, but I think as I've looked and heard, that's kind of what the trend seems to be showing. There's always unfilled positions on postdoc. You'll hear that often, but I'm not always certain those are unfilled neuropsych positions. But I would say for the most part, there's a lot more postdoc opportunities because it's just not required. It's not required for graduation, right? So if you're doing that 2-year commitment to follow Houston Conference to be board eligible, you're a unique type of person, and so because not everyone's looking to pursue that, then there's not always as much competition around those positions. I say that, and also the coasts are very competitive. So I think regardless of kind of what you're hearing, there's going to be a lot of competition on either coast, whereas opportunities, I almost said the mainland, oh my gosh, opportunities not on the coasts are going to be a little bit more abundant. So there's not they're worse training, not that they're even worse pay. It's just that they're less sought after for the most part, or they're just not as dense in terms of population, things like that.
Is there a difference between the Houston what is it, Houston Conference guidelines and the Minnesota Conference guidelines?
The Minnesota is an update to the Houston Conference guidelines. In terms of training, no, but I think they've added some additional things in terms of like competencies and things like that, kind of goals and trajectories they're wanting to go as a field.
I also don't think the Minnesota guidelines are in place yet. There's a lot of buzz on the board, on the ABAP listserv about the Minnesota guidelines. I don't think they've been finalized. So I think everybody is still operating under the Houston guidelines.
Yep.
Do you happen to know what the updates are by any chance? Or like, is there
I
like,
don't think it's conclusive yet.
oh, okay.
I just, yeah, it hasn't really happened yet,
Yep.
as far as I know.
There's some documents that have like circulated that are drafts, but yeah, nothing formally proposed that's been voted on.
I'm
Yeah,
a
but that's
little.
something that
Go ahead.
I was going to say one thing related to that is like if you're on the fence, whether it's internship or postdoc, and you're not sure like where does the site sit in terms of things, like you can literally just find Houston Conference guidelines in their materials, and that's going to be like the key selling point kind of thing. So if they don't have that language in there, then no, it's likely not following those guidelines. So something to keep in mind. Sorry, go ahead.
No worries. And thank you so much, Mitchell, for this information. I'm more so curious about the networking piece. I have found that going to conferences is very life-giving, and a great way to connect with people. I'm wondering if, in your experience of preparing for internship and postdoc, if conferences were useful to you at all in terms of connecting with people and getting just that face-to-face connection before applying to internship and everything. Just wondering about networking opportunities in general.
Yeah. I typically attend INS. That's the kind of annual conference I go to. I sit on one of the boards of one of the SIGs, the special interest group, and so but for me, it's a more casual way to meet people. I feel like everything in neuropsych can be really formal, but INS in particular is really laid back. And so if there's someone that I'm wanting to meet, they're much more approachable at a conference than they might be at like a talk they're giving or like in a more formal training setting. And so in that case, I feel even though I'm pretty introverted myself, I would feel pretty comfortable approaching, making an introduction either for myself or for someone else. Um, the same goes true for like other trainees that you might be working with and getting their input on how things are and kind of talking with them. I mean, that word of mouth piece, the brochure of a program can say one thing, but a trainee's experience can say a lot more. And so it can always be helpful to share that knowledge with them.
For the
I've got a
who,
oh, go ahead, Adita.
sorry. For the students who are like set on neuropsych, but they're SoCal bound, what advice would you give to them to make themselves more competitive for the process of applying?
Um, it's a good question. It's a difficult question too. Because every student is different in terms of what they're bringing to the application, right? And then every program is different in terms of what they're looking for in their students. Um, I would say for SoCal, they're still looking for that generalist model, right? So they're still looking for a broad depth of training, um, with like some maybe future orientation towards neuropsych. And so bring that up in interviews, bring that up in your materials. And it may be you end up applying to more sites because of that geography component. Um, I think the recommendation is still 15, and so you may consider more than that, just as kind of a safety net in a way. And I think that's kind of where it goes. I wasn't successful at doing that, so I can't give you like the recipe, right? Like I'm not sure exactly what that looks like, but I do know that for me, having to move out of state for a year, I thought would be really devastating, ended up being really, really rewarding. And so I think I have to come back to that now and realize I'm really grateful for that experience. Even though when I didn't match and then matched, I was not looking at all forward to having to like uproot to Denver. So, but I kid you not, like I'm literally wearing socks that have the Colorado flag on them today. So like it makes an impression on you, even if you're only there for 1 year, kind of thing. But do what you can in terms of really casting that net really wide. There is a lot of opportunity here, but yeah.
That's helpful. Thank you.
I've got a question in the chat that I think only I got, so I'll answer it real quick. It asks, what does my schedule look like in terms of both my teaching and my clinical work? Like how many days or hours do I spend at UCI versus the VA? And did I negotiate this arrangement? This is an interesting and fascinating question because this was going to change, but now I don't have to change it. So I have a what's called a flexible schedule here at the VA. So I work 4 10s. So I work Monday through Thursday from 7 to 5:30. And that was negotiated when I was interviewing. And 2 of my days are here in the clinic, and then 2 of them are at home. So for me, that was a big thing of like wanting to kind of adjust family life and things like that. It was a priority for me to spend some time at home. And so that was like a written agreement between the program director and I. However, as you can imagine or may have heard with recent executive orders, we have a return to office currently. And so that agreement was kind of abolished. But we're currently on a stay in Long Beach. So they haven't fully put that into effect. And so I still get to maintain my work from home days, but I'm not sure how much longer that will be happening. That's part of that large ship that all of a sudden is quickly turning kind of thing. Um, and so yeah, that was part of the agreement that was really unique to this site. It's one of the reasons why I chose Long Beach is that balance was really important for me. Not every VA is going to offer that kind of thing. Um, okay, West LA is in the same situation. No surprises there. In terms of UCI, so I teach one class a quarter there, and so I'm contracted annually. And my contract just renews, and I'm able to kind of keep that course load until I decide to diminish it. So that's kind of how it works within the UC system. So yeah, I got to pick when I taught courses and things like that, which I am really grateful for. Kind of flexes with my schedule. I teach 2 evenings a week, kind of thing, and so I have some longer days for sure. But for me, I have Friday off, and so that's the day that I get to like spend at home with family. Um, and I like watch my daughter while my wife works that day. So for me, it's like a really important time to have that off. I teach some undergraduate courses. I teach like introduction to clinical neuropsych. I teach psychobiology, and then I teach a grad course on kind of like assessment and psychometrics. So all very neuropsych related. If you know me at all very uniquely Mitchell. But it's a lot of fun. So yeah, it's really.
Thank you so much again. I really appreciate this time, and the opportunity to get to ask you all these questions. So thank you for being here. One question I wanted to ask you regarding internships, what kind of like key points or things would you say that we should keep in mind during our interviews? What are some important things that we should touch base on?
Yeah. Um, One thing that I keep in mind, and sometimes you can find this in the program materials, but for me, it was really important to know like what my rotations would look like. Am I rotating every 6 months? Am I rotating every 4 months, every 3 months? To see like what the pace of internship would kind of feel like. And so if you don't get a good sense of that, that could be a really good interview question. Because I think that fits under that category of fit. If you're not someone who can adjust like to a quick pace turning over all the time, that
Right.
like 8 to 12 week turnaround could feel really, really quick. I'm settling in, all of a sudden I'm moving on. I'm settling in, I'm moving on. So for a whole year, you may just feel like you're just being pushed through internship. So that might be something to consider. Um, the other thing would be like who you're going to be supervised by. And so getting an idea of like who some of those people are. You may be able to get a sense of that beforehand to kind of do some background research, if you will, some Googling and some LinkedIn searches. But kind of knowing who you'll be training with is important because those people's connections could help you land your postdoc. Those postdoc in neuropsychology is very interwoven, I think might be a good word to put. A lot of people know a lot of people, especially regionally. And so your current supervisor or previous supervisor may be the one who makes that connection for you for postdoc. It's oftentimes a much more like professional engagement than it is like a contractual agreement as a student. So, um, and then I'm always curious about like didactics and things like that. I ask a lot of questions about that in internship. Sometimes they have specific didactics for neuropsychology, and sometimes they're just generalist didactics. And so it's helpful to know what you're going to be covering, things like that. Um, if doing surgical evaluations or being involved in brain cutting is important, those are probably good interview questions as well to see what like the rate of that is at the hospital, things like that.
Gotcha. Thank you.
Mhm. Looks like we've got just a few minutes left if there's any other questions.
I have one more.
Go
Um,
ahead.
would you say, sorry, would you say, outside of like intervention hours as well as assessment hours, which I feel like intervention hours weigh more than do assessment hours when it comes to internship applications, do you think there are other things, like poster presentations, any coursework that helps you kind of stand out more? Um, and if so, what are those things?
Yes. I think you've got some of them right there. I think poster presentations, papers, book chapters, guest lecturing, like tea opportunities, all of those things that are kind of above and beyond what some other students may be doing. Sometimes those are ways to like sometimes certain sites rate those or rank those on their process of applicants, so that's important to consider. Another big one would be like public service. So being involved in like leadership organizations or like trainee-based organizations would be like another thing that kind of catches people's attention. Whether or not that's neuropsychology related, I don't think that's super important, but just those extracurriculars can be really helpful. And then I'll say something that is kind of answering something you didn't ask is I would make sure that as you're writing up your hours for assessment and things like that, that it really relates to like the number of reports you've written too. I think as I've reviewed applications, a big red flag is when I see either a lot of hours and few reports or many reports and few hours. I think that's a big red flag for people that know what the balance should be between them. And so oftentimes that's like a right in the paper basket type of application if we see a mismatch between like report hours and the number of comprehensive reports. So that's a little detail that I know for if a neuropsychologist is reviewing the app is a really big deal.
Gotcha. And I think on time to track, it's kind of confusing because it is my understanding that once you add like your hours, let's say you did Trails B and you did report, I'm assuming there should be like a general amount of reports you wrote, not necessarily when it comes just to Trails B, how many times that was set to be in a report. I hope that makes sense.
Yeah, they're looking for like that like multiple domain type of assessment. If we're looking at like the number of times you've given things and your hours and your reports, they're kind of looking to see does this all make sense here, and if there's if it's off balance, I think for them they kind of begin to ask some questions about not necessarily you even as applicant, but how did it get past the DCD and like some stuff like that. It just becomes a little bit more concerning. So it's a big red flag.
Right. Yeah, gotcha. Thank you.
I think we're out of time if we don't have more questions.
How can we stay in contact? Does your fuller email, do you still answer that or?
I do. Yeah, I can't promise a 24-hour turnaround, but I do regularly check my folder email.
Okay. Don't worry, I'm not asking for a 24-hour turnaround. Don't worry.
You also might see me on campus. I teach a course on Monday evenings occasionally, and so you're always welcome to come and pop over and say hello. But yeah,
I see students smiling on the way to CBT. I think it's CBT.
yeah, I teach the cognitive and affective course.
Okay.
So yeah. The email is the best way to get a hold of me. And yeah, if you have questions about anything related to internship, postdoc, or anything we talked about today, I'd be happy to reach out, or I'd be happy to have someone reach out and respond. So
Thanks so
Thank you
much.
so much, Mitchell. This was really helpful. We
Thank you.
appreciate your time.
Thanks, Mitchell.
Thank you.
Thank you. Have a
And
good
for
night.
everybody else, we do have a meeting 5 o'clock on Wednesday. This is going to be a lecture presentation, so hope to see you all there.
bye, everyone.
Thank you. Bye.
Bye, Mitchell. Thank you very much.
Thank you.
Thank you. Bye-bye.
Bye.